So you work in the medical field.
Yeah.
You've seen what's going on with COVID. I imagine you've seen some pretty crazy things. Is healthcare a right?
Well, let's think about this, right? Let's say you stab Nate,
Yes.
right? You go to prison.
Mm-hmm.
Guess what you get? Free healthcare.
Mm.
You stabbed our friend Nate in cold blood,
Yeah.
and our society has determined that you deserve healthcare while you're a prisoner, right?
Yeah.
But you leave here right now. You go outside and you give a homeless person $100. Let's say, you know what, you cure cancer. In America,
Okay.
you don't get health care. Right?
Yeah.
You could be the greatest person in the world in America,
Mm-hmm.
and your health care is no longer a right. You need to buy it.
Okay.
You need to pay for it.
Mhm.
Right? And in my eyes and in what I've seen in the hospital with people who don't have the means to pay for their health care,
Mm.
for simple things such as I have diabetes and I'm gonna go blind or lose my feet if I don't get this insulin.
Jeez.
And they're like, okay, can you pay for this? You know, they don't care. That you got to pay for it, and that's capitalism. But I think healthcare should be a right in our country at this point. We have the resources to and the ability to make it a right,
Yeah.
and I think it should. And does that mean I don't recognize that it's expensive?
Very-
No, it is expensive,
No.
especially when our country is so sick. And I'm not saying that, hey, let's just give everybody health care and just call it macaroni. It's going to fix all our problems. It won't fix all of our problems. It'll help. It'll help bring up the lower part of our society that are really struggling
Yeah.
and are most affected by health problems and try to improve their lives. It will not make them equal to everybody else or to the richest people. It won't do that because there's so many factors that play into health.
Yeah.
But I think that, you know, you go to prison, you commit a crime, you get health care.
Yeah.
Why can't we provide that to hardworking citizens in America? Why not? I mean, why not? The answer is, oh, it's expensive. Oh, it's going to take change. Oh, I'm going to have to take more out of my paycheck to pay for it.
Mhm.
Oh, some people might even say they don't deserve it.
Yeah.
They smoke, they drink, they don't deserve it.
Yeah.
And I understand why you would say that.
Mm.
But the positive that's going to be created in other people's lives that do deserve it is
Yeah.
going to be significantly greater than just, saying, well, that guy doesn't deserve it, And also, how can you define that? Like the hate speech thing. How do you
Yeah,
define
it's
it? Right?
Well, I drink and smoke. I think he deserves it.
Right, yeah.
I would hope he gets it. Yeah, no, that's definitely one of those tough topics. I think people always talk about but the cost, the taxes,
I don't think it should be a tough topic.
Yeah.
This is not like the hate speech thing.
Mm.
And I'll say that it's not like the hate speech thing because the hate speech thing is really hard to define.
Yeah.
Healthcare is not.
Yeah.
These people, if you go to I worked at a county hospital in Phoenix, right? And a majority of the patients there are low socioeconomic status,
Mhm.
refugees, undocumented immigrants, people that are disabled.
Okay.
These people's lives are being ruined because they cannot easily afford healthcare.
Yeah.
It's so hard for them. Imagine this, right? Let's say this. You got two jobs.
Mm.
You got two kids. You don't speak English. And you are like, you know what? My vision is going bad. And I don't know why.
Mm.
Also because you don't have very good education. So you're like, I'm going to try to figure out how to get a doctor's appointment, right?
Mm.
Well, you find out there's plenty of doctors around. And you find out, okay, one, it's 20 minutes away by bus. It's going to take $100. You have to pay $100 to be seen by this doctor. And it's going to take 4 hours, and you're going to see the doctor for 15 minutes. And all he's going to say is, you have diabetes, which you already know, and you already know that you have to take insulin to take care of it.
Yeah.
But now you can't pay for the insulin because you don't have insurance, because they denied you because you have diabetes. This is a pre-existing condition. You have two jobs, so taking the bus for 40 minutes is going to take a big chunk out of your day. The appointment's going to take 4 hours of you just waiting in the appointment room.
Mm.
And you're only going to see the guy for 15 minutes, and he's going to tell you something that you already know, right?
Yeah.
That's reality for millions of people. And they just say, I'm not going. I'm not going to do this.
Mm-hmm.
Now, if it wasn't $100, it was easier to see people. There was going to be faster appointments because there was more doctors paying for those kinds of things or working with the low income kind of people or primary care doctors. And you know what? You saw them twice last year instead of, you haven't seen them in 10 years.
Yeah.
You know, you're going to feel a lot better about it. You're like, well, it only, you know what? I go twice a year, and I always have, and it costs me nothing. Why not? You know, it's going to take down that barrier. Then you're still going to have the bus. You're still going to have the two kids, 2 jobs. You're still going to have those problems, but it's going to take out the money part of it, right? And since you saved $100 on, you know, the appointment costs and your insulin, now guess what? Your life's improved. Now you have more money for your kids. Now maybe you have money for an Uber. And now you don't have to spend 40 minutes getting on the bus. You can just get there in 10 minutes, right?
And your health improved.
Right, yeah. And you get to the hospital and the doctor's like, oh my God, you have glaucoma, man. We got to take care of you right now. And then guess what? The medication for glaucoma, boom, saves your eyesight. Now you can continue working for the rest of your life without going blind. Now your kids' life's improved. Now your kids are going on and making better lives for themselves. Your wife's life is improved. It's just like such a small, like you don't realize that those small things really they have a domino effect of better things happening. And when people say, you know, in my opinion, when people say, oh, it's going to cost me more taxes. Yeah. I'm saying it's going to cost you money to greatly improve the life of somebody else. Yeah. That you're pretty selfish when you say that. Yeah. You know, and it's not. That's pretty clear to me. And you know, it's like, oh, it's going to cost me more money on taxes. It could possibly prevent somebody from going blind, or they have cancer. You know, and that $10,000 medication that they have to pay for now, that they're going to be in debt for the rest of their life, or they just say, I can't afford it, I'm going to die. They may get that medication. How awesome is that? Just think about it that way. Don't think about, you know, this cost me whatever. Think about, you know, this is really benefiting my society, because then that guy is not going to die. His kids are going to have a better life. They're going to lead possibly more productive. I'm not going to say it's 100% guaranteed, but it's increasing that probability, you know? And I just think if you think outside of yourself, it becomes less of, is it a right? It is right, you know? Especially nowadays, back maybe in the Romans, where I'm a farmer, and I lived to 26, and that's a full life. Things are different. But nowadays, people are living, you know, 100 years. Yeah. So
I would think a lot of people, though, when it comes to, oh, my taxes are raised, it's not so much that they're selfish and they don't want to help somebody. They think, my taxes are not being used for anything good. Because I pay $40,000 a year in taxes. I have not seen a single government program that has worked. We're good at blowing people up and collecting taxes. That's about the only 2 things that the government is really good at. So I think an argument against that would be, why would I give more money to an already failed system when, like, inherently the American government was set up to be hard to get things done. We were set up with bureaucracy to make it slow. So why am I going to give extra $5,000 a year in taxes if it's not going to help anybody, because the government programs already suck? Like, is there a way to get around that, maybe, rather than putting doctors with $600,000 student loan debt? If we say, hey, we're going to pay for all of your schooling, we're going to support you all the way through, and we're going to give you a lower income tax, but every doctor you have to help out 15 people a year pro bono, no questions asked. Like, maybe if it was sold a different way, rather than, we're going to raise taxes 10% and throw money at it and let's see who gets something done. 'Cause I think that's people's biggest thing, is like, I want to help people, but I don't see, like in California and LA, there's like 40% tax every year. I don't know the actual numbers. Some crazy amount. They're like, there's 7 homeless people living out front right now, and I make $400,000 a year, and 180 of that was given to the government, and there's still homeless people in front of my house. So like, where's this money going? I think that's the biggest issue.
Yeah, that's fair. And I get that. You know why? I get that because I thought I had that too. Before the hospitals and my experience in it, I thought, you know, what is happening? Where does the money go? We have all this money. I mean, you hear, you know, $1 billion. You're like, oh my God. Yeah. You know, geez, that's a lot, right? And I think, right, what is that? Where is it going? And I totally get that. And I got into it, and I think what you said is right. It needs to be sold in a different way. Because when I got into the hospital and I saw people getting, eye procedures that were potentially going to save their vision from diabetic retinopathy and glaucoma and things like that, they're getting it paid for through Medicare. Medicaid, which is expanded through Obamacare and they're getting it paid for. These people they're like $10,000 procedures, and they're getting it completely paid for. So they're saving their eye vision through this. I see it. I'm seeing them come out of these procedures and they're doing great. They're saving their eye vision. To me, I'm like, that's incredible. I'm seeing the positive that the tax money from Obamacare did. And I'm thinking, well, if everybody saw this, then they would be. So it needs to be changed more. And I'm right. And there is again, this goes back to, I'm getting taxed this much and I'm not seeing that great of change. I think still it kind of goes back to somewhere there is being change done. And
just because you don't see it.
You don't see it right away. You just have to have faith, but there should be promotion of what's going to happen. And that doesn't mean that things can't get better. But things do get better. And there's studies about it. And that if you look at the health of the lower class in Britain before they had, I think it was in World War II, before they had universal health care. And then after they had universal health care, the National Health, I can't remember the acronym, but when they had it, it did bring it up. Their health increased, their mortality rate went down, the lifetime expectancy went up, things got better for them overall. So you will see it. You just have to pay attention. It's not gonna be remove the homeless people outside of your house. I don't know. Maybe it should. I don't know. Healthcare is not gonna do that, or maybe it will if they got more mental health care. I don't know. But I just think in your whole life, yes, money is important. Yes, all these things. But, once you're making over $400,000, you're pretty secure, man. Your kids are going to go to college. You're not starving. You're not suffering at $400,000. And I get it. You earned it. I get it. Yes, it's yours. But this person has nothing. They have nothing. Like, oh no, this person got, these kids are not receiving weekend lunches from United Way in Arizona. They're not starving over the weekend for your taxes. Like, kids are, starving. They don't have health care. Think about kids. People always like to think about kids. They're like adults, whatever. But kids, they're really going to benefit. So I don't know. It is a right in my eyes, and it should be, especially because we're giving it to prisoners. Shit, we're giving if people don't deserve it and it's costing you too much money, don't give it to prisoners, right? So it's like, if we can do it for prisoners, we can do it for our society. Things are gonna get better for other people, and it might not make your life better. That money that you give to the government might not make your life better, but it will make somebody else's a little bit easier. Even if a little bit, okay.
And I'll touching on Obamacare, I would say 99.9% of people that have an opinion on it actually don't know what it is, or have read into it, or maybe looked into how is it actually helping people. They just saw some news agency say Obamacare 40% less effective than before, and it's this sucks. Get rid of it. That sucks. But it's have you actually read into? Have you talked to someone that works in a hospital that is actually seeing this person got an eye surgery that they'd be blind in a year if they didn't get. I see the direct effects. And I'm guilty of that myself. I've seen a million different things on why it's good and why it's bad, but I've never actually researched it one bit. So I'm glad that it's actually doing something and you're figuring that out.
Look, a quick synopsis of Obamacare is pretty much that it's increasing the amount of available health care for people, right? And it's kind of preventing health insurance companies from jacking up the price, keeping it at a more reasonable price in the market, and also preventing health insurance companies from people. We're not going to insure you because you have diabetes. Or
everybody's got diabetes. I feel now.
Well, I'll give you a statistic real quick. Nearly, I think it's 43 or nearly half of Americans have one pre-existing condition, and nearly a third have two or more. And so a pre-existing condition might be hypertension. Me and you might have hypertension. Also, they might have obesity. We know our friends, 22-year-old males. in America, living all the food they could have, right? They are obese. They would have a pre-existing condition, or they smoke, or they did. And a pre-existing condition might be you smoked 5 years ago. You even quit for 5 years. Well, they still might declare that, and you would get denied coverage. So Obamacare reduced those health insurance companies to deny those people. They reduced the problem, their ability to jack the prices up because of those, and it did. It expanded it by a bunch. It gave millions of people health insurance, and that's great.
Yeah.
Because now this health insurance is giving these people more opportunity to get cared for. Now that people always say, well, it made it more expensive for the middle class people, and unfortunately, I don't know enough about that to say if that's true or not. I don't believe it did. I think maybe a little bit, or maybe it cost McDonald's more money. Like my dad works for McDonald's, and he's like, yeah, we got to pay for everybody. McDonald's is a $1 billion company.
Yeah.
Okay.
And the reason everybody has diabetes, they're obese.
Right. Yeah. Exactly.
There should be an obesity tax on these companies like Coke. How many people have? I know there's no statistic. How many people have died from drinking Coca-Cola every day and just rotted the inside of their body, insulin sensitivity, and
think about this. It's called a sin tax, right? This is something that I like. So sin tax would be charging a tax on chocolate bars or cigarettes or tobacco or Coke or things like this, or gambling or alcohol. So what happens is if you want to go to the store, this does for cigarettes, right? You go to the store, cigarettes used to be like 10 cents a cigarette. Now it's like $8 for a pack, right? That's a sin tax. And I kind of like the idea of using sin taxes on things that you might not think of, like Coke or soda or hose. You go to the Walmart section, people's carts are just full of whatever, bread. It's whipped cream. Sin tax on those kind of things, a sugar tax, right? You can call it that, And you could literally think about how many Cokes are being sold, You increase price a little bit. I don't know the numbers. I wish I knew the numbers, but you could take money from that to pay for people's universal health care. You're gonna pay for it at some point, because if they don't have the money, taxpayers are going to have to pay for somebody's health care, right? So you can do that. Also, maybe use the sin tax for better education. We teach people better than we are right now, which is barely any. Don't drink Coke. This has sugar. What is diabetes? What is obesity? How do you prevent this? Or we give them more of an opportunity to work out for an hour. We pay them enough that they have enough time to work out or whatever,
Maybe like part of your 8-hour work day. You work 7 hours and your boss pays you for the last hour as long as you show you went to the gym.
Yeah, maybe something like that. I have no idea, but we got to do two things. Well, we got to do a lot of things. More education, more access to health care, and less of me, and more of other. Yeah, exactly. I think that's a good point. Why not? What's the worst thing? You ever give a homeless person $10? You feel good. You feel good about it. It's okay. That's guilty. I feel great. I'm like, God damn, I'm a good person. Here's $10.
Yeah.
That's joy. That's joy of helping somebody else out, and we can cultivate that through doing other things like that. So yeah, I think if healthcare was a right, that'd be awesome. Dental care too. That'd be awesome. Yeah. A lot of people out there with no teeth. Nate.
All right. Well, I think that pretty much sums up everything we were trying to cover on this. Thank you for watching, and go ahead and tune in for some. Go ahead and tune in to later episodes. Thank you.